here.
Hey Mark, how you going?
Good, Al. How are you?
Yeah, it's been quite a day at the old office, down the pit,
Hasn't it just?
down the mine.
Yeah,
But look,
absolutely.
thanks for your time. I just really wanted to touch base with you and just have a chat because well, we've got these students in History of Healing, as you know, semester 1 subject, and right now they're up to weeks 4. They just started week 4 today, and it's right in the middle of those lectures which you recorded a while back, and I just thought it'd be nice to put a face to a name. So how about let's just take 10 minutes and have a chat to the folks. So I mean, tell me a bit about yourself and your role at Endeavour in acupuncture.
Sure, Al. Look, I'm program leader for acupuncture at Endeavour College. From my own viewpoint, I've been practicing since the 90s in both acupuncture and naturopathy, but sort of originally came to the college through personal experience of acupuncture having worked for me and to really enroll in the Chinese medicine program.
So I've noticed over the years that your business card's got a number of extra letters that go along after your name. What's that all about? What have you done in terms of your qualifications and things?
Sure, with the promotion of our profession, Chinese medicine and naturopathy, but more specifically Chinese medicine for here, I've sort of moved ahead with my own qualifications. So certainly in Chinese medicine, I have a Master of Applied Science in Chinese Herbal Medicine, which allows me to be a raw herbalist.
Okay.
But I also have a Master of Acupuncture through University of Western Sydney, which was to further augment my skills in acupuncture, and originally a graduate from the college with a Bachelor of Health Science Acupuncture.
All right, that's a lot. So it's a lot of masters.
I like to be good at what I do.
And that's really important because one of the things that's really important to me as a practice, well, as a I suppose an academic, is that I still make time for my clinical practice, and it's the same with you, isn't it?
Absolutely, and you can't lose sight of that clinical practice. It's so very important. It gives context to what we're teaching. But not only that, it just, you really enjoy what you do, and it's good to get in the practice and do that.
Sure. So for me, I mean, over the years, I mean, I've been practicing homeopathy 20 years, but it's pretty hard to be in natural medicine and not look around. One of the things I've noticed about acupuncture and Chinese medicine in particular is its incredible efficacy. Many times I've been working in a clinic, in a larger clinical context, and there's the acupuncturist down the corridor, we're referring clients. So for me, it's just always been amazing about firstly the results, but more than that, it's that the philosophy of Chinese medicine really gets people, and it really, it makes, it makes intuitive sense even in the 21st century. What gets you passionate about it?
Oh, look, just clinical efficacy, as you said before. Empirically, it's had thousands of years of development. We've got texts dating back to, BC, so to speak, with acupuncture points that we still use today for some of the, clinical relevance for just as much now as back then. And obviously how that's evolved clinically from that time. And more recently, the level of evidence that we've established within the peer-reviewed journals and the systematic reviews and the like just really demonstrate the efficacy of both acupuncture and Chinese herbs as effective treatments in management. And I mean, we're getting to the point now within Chinese medicine where we're starting to identify treatment protocols. So in other words, if you come in with a particular condition, it really requires, within the randomized controlled trials and systematic reviews, they're really starting to say, you may need to use this group of points in the case of acupuncture, and you'll need to see a patient for X number of times, so many times a week, to effectively manage that. And, that's validated by research. So it's where evidence-based practice is augmenting empirical evidence and really demonstrating that what we're doing is very effective and further supporting what we're seeing in clinical practice, and so rewarding as a clinician to sort of see patients get off the table with really great results.
Yeah, it's interesting there because in that sense, I mean, I suppose what I say to the students in the first 4 weeks in History of Healing is that we're between the worlds, and it's kind of, I like it. I like being between the worlds. We're honouring the traditions and such deep foundations and traditions of philosophy and history in, say, Chinese medicine, but also we're in the 21st century today in contemporary Australia, and what you just said there about evidence is so crucial. So that's interesting. How much do they get of that, or where does that come into their program?
Throughout the program, obviously, as the program progresses, it becomes more of an underlying focus, particularly in fourth year, because we're sort of augmenting all that empirical knowledge that we're training throughout the program and sort of bringing in that modern evidence. But I think it's going to be more important as time moves by, and certainly with everything that's happening, and being able to espouse these sort of values with your patient, but also with other healthcare providers, and saying, well, the current evidence states this, and this is the treatment protocol required here. It further validates why one would be employing a particular group of treatments from a duty of care perspective with a patient, and prevent over-servicing.
So it's not just about languaging. It's not just about having the language to talk to clients that ask contemporary modern questions. It is actually a commitment to evidence and working our way up the evidence hierarchy, and that's what it sounds like, really, from what you're saying.
Absolutely, and I think it goes a step further than that, because the benefit is all that empirical evidence that we have. It's very, very valid, and if anything, it's actually helping to direct the research that we do, because we know it already works. So in this case, we actually have an in to actually determining what the research should be, and helping to evaluate that, and actually put some protocols around that. So in many cases, the empirical evidence is actually guiding the design of some of our research methodology, and basically not necessarily biased, but certainly providing us with a wealth of insight into, if we design a trial in a particular type of way, we may be more likely to experience a particular type of outcome. And so that's where the good researcher comes in, and certainly gets us sort of an insight into how to potentially design a trial in a particular way.
It's kind of interesting, isn't it? Because these students are at the beginning of their journey. They're essentially in, like it's week 4, semester 1 subjects, and off they go. And if you remember the course structures, what they're getting is really just a little quick foundation, like why are we here? How did it get to be the way that it is? So there's those 3 or 4 lectures on Chinese medicine, Ayurveda, and now they're heading into European history from memory, and European, I suppose, healing and medical principles. So what do we say if let's project 4 years down the track, so those students are running out of Endeavour College, full of knowledge, so what are they running into? What's the environment they're running into for you?
Well, absolutely one of a very strongly emerging profession. If you look at statutory registration as it currently stands, and Chinese medicine's going to join physiotherapy and medical practitioners and nurses and the like as a registered practice, that gives access to lobbying for Department of Veteran Affairs and Medicare and the like, which normally you can't gain access to until you gain some form of statutory registration. So that's enormously important, I think, for the profession and its growth into more of a mainstream style of practice. But beyond that, clinically practice-wise, Chinese medicine probably has some of the best business models to work by. And from a successful practice model, one could work in a single treatment room, and sort of have patients in one room at a time, or alternatively they can move to the multi-room style of model, particularly with acupuncture, and manage a number of patients at any one time. And it's financially rewarding as well as ethically and morally rewarding, because you're getting those clinical outcomes for people. You're helping them. They're getting off the table even after maybe one treatment, really demonstrating that they've got great results, and sort of sometimes your best advocates or advertising in this particular case, because they're going out and sort of promoting what you can do to the world, and at the same time you're obviously receiving some form of financial outcome from that, which obviously allows you to be a successful practitioner. So that's very rewarding, I think, and certainly I think you'll find that a lot of Chinese medicine practitioners that sort of move into private practice with the right models are doing very, very well for themselves. So I think it's a very bright future for Chinese medicine professionals as a whole. There aren't too many of us out there. Currently it's expected to be somewhere around 3,000, 4,000 practitioners nationally. You compare that with something like physiotherapy or medicine, you're talking, thousands upon thousands, getting into the, 30, 40, 50,000 or more in certainly medical practice. Nursing a lot more than that again. So as a profession, we're actually quite small, but we, have that enormous opportunity to service such a large area of the actual public. And as we continue to grow and that evidence continues coming out, it's going to be generating, new avenues for us to be moving in the, conventional area and establishing new pathways for our graduates and our practitioners out there to be doing even better.
For sure. Fantastic. I think it's what you and I share in common is we love the coalface. It's great to be in the classroom, but it's also really rewarding to sit in front of a client or to, in your work, really work with a client in a technical way as well as in a engaging them in their health and making a big change at that level.
There's nothing better than seeing them get off the table with that big smile on the face and sort of go, hey, I can't feel that pain I came in with. How'd you do that? So, and it's no trick. It's just obviously applying the Chinese medicine in this particular case appropriately and in a way that obviously is conducive to a great clinical outcome. And, the patient, they know it when they get off the table. And that's probably one of the other great rewarding parts about Chinese medicine. It's not something that they, may expect to see after X number of treatments. They can often see that after the first treatment, that improvement. And you can see it going through their eyes as they're processing, going, hey, that's pretty good. So, that's rewarding in itself.
It's great. Anything else that these folks need to know?
Oh, just welcome to the profession. And you picked a good profession if you picked Chinese medicine.
Absolutely. Mark, thanks so much for that. It's really important that I think people, just make those connections and, as program leader, if they choose to move into Chinese medicine, then, you're the man. So thanks for your time. Really appreciate it.
Yeah, welcome to the natural medicine profession, guys, and thanks for your time, Al.
No worries. Cheers. Bye.
Take care.
Bye.
See you.